Some women have breast lumps in their breasts and they never even know because they don't feel it or they don't check. While some may even have obvious lumps as big as this. I tell you the truth, as big as this, and they don't care to even check it out to see what it could be. Clock is ticking, and that is very, very dangerous. Hello everyone, welcome to my channel, Everyone Journey with Dr. TRO, where we teach you how to understand your body, how to identify issues early enough, and how to seek adequate, appropriate medical care. Today we'll be talking about 5 facts about breast lumps that you may never have known. Fact 1. Breast lumps may have been growing for years before you even notice it. Yes, because breast lumps start from tiny abnormal growths and gradually get bigger and bigger before you even notice it. And far be it had been cancerous. Sometimes even before you can feel it, it has started damaging your system. Breast lumps generally are usually among older population, elderly women, or let's say middle-aged to elderly women. But recently, and in a few cases, I've seen them among 20s, women in their 20s and 30s. Like, yes, I've seen a 24-year-old with advanced breast cancer. And most of the time, the reasons are that they never knew it was cancer. They never knew what to do. They were taking medication. Fact 2. Yes, I know you'll be worried. Truly, not every breast lump is cancer. But how do you know if it's cancer if you don't check? Because the breasts of young ladies, particularly, very fatty and can obscure the appearance or the feel of the growth of the lump. Similar, just like this sponge over this, you can see, you can appreciate the fact that this is a stone with different shape, with an irregular shape and no form, compared with this pearl. Compared with this pearl that's smooth, you have similar feeling over it. So not every breast lump is cancer, but as much as 3 to 10 in every 100 cases of breast lumps are cancer. Fact 3. A painless breast lump can be more dangerous than a painful one. Let me explain. You know, in our locality, if you don't feel pain, there's some people, if they don't feel pain, they will never go close to the hospital. They will never seek medical care until they feel pain. And that is the danger for breast cancer. Because the painless ones are usually more likely to even be cancerous than the painful ones. Because most times, the painful breast lumps may just be engorgement during breastfeeding, may just be some infection of the breast. But cancerous growths usually are painless until they are grown so big to be able to stretch the breast and make you feel some discomfort. And by the time it has started giving you pain, trust me, damage is ongoing already. So if you have a lump and you think it's painless and you think it's not to worry about, sorry. The painless ones can be more dangerous than the painful one. So at any chance you feel a breast lump, kindly visit a health facility, see a doctor to guide. Fact 4. The smaller the breast lump, the better your chances. The smaller the breast lump, the more chance of having lesser complications or even no complications. Why? Because the smaller breast lumps are easier to manage without the consequences, even if it were breast cancer and identified very early while it was still small, like this pearl. However, if you allow cancer to grow this big, I'm sorry, your chances are slim. So when the lumps are small, that's the best time to seek health care. Do not wait for it to get as big as this and think you're saving money to do the operation once and for all. there is no time in cases of breast cancer. Fact 5. Breast cancer may not necessarily run in families. It could be sporadic. It could happen to anyone. I know some people by now are saying, God forbid, can't be me, God forbid, we don't have it in my family. Breast cancer is not like birthmarks. It can happen to anyone. You don't need to have a family member with breast cancer before you know that you have a chance to have it. Don't wait for one family member to have been diagnosed before you check yourself. Yes, breast cancer runs in families, and for such people, it's even an advantage to check themselves early. But even if it doesn't run in your family and you feel a lump, some people have their bath every day, they feel the lump, they feel the seed in their breast, but they don't do anything about it. Every single day, I get to see cases of breast cancer, cases of advanced breast cancer, cases of breast cancer that are not reversible. There was a patient I've seen at 24, young lady, full of life, full of future, and by the time I scanned her, I discovered this is advanced. This has gone. It has gone far, and her chances are slim. And it's even worse when your chances are slim and you seek health care and you delay it. You defer it because why? It's not painful. You're waiting for the dangerous days. Cancer, at the slightest point, time you identify it, that's the time you should start seeking help. It's advised that at least every month, every woman does a self-breast examination. Check the links in my pages. You'll see some guides on self-breast examination and how to do it if you don't know how to do it. Every month, at least once every month, you examine your breasts, both breasts. Some people advise do it under the shower since there's some soap and you can easily glide. Examine your breasts, check your breasts. So one, the essence of even checking now that you think or you feel there's no lump is because it's important to even know how your breasts feel in the first place. So that when there's a lump, you get to know this thing feels different than how I used to feel it before. Secondly, if you examine your breast and for any reason you suspect, they may not be. Yes, they may not be because the breast is made up of different structures that may make lumps, especially small lumps. They may not be. But there's no harm in seeking health care. You're going to a health practitioner to check your breasts, who will usually guide, probably examine you himself or herself, and send you to a lab, at least perhaps to do a scan. There's no harm in knowing that, okay, there's no lump, or even knowing that, okay, it's not cancerous. But either ways, the doctor will usually guide on what to do. Some cases, you even have to remove these lumps to confirm if they are cancerous. So the earlier you identify these lumps, the better. Thank you for watching. Kindly subscribe to our channel. I will look forward to seeing you next time. If you have any questions, queries, comments, please do well to write it in the comment section. I will be sure to reply you adequately. See you same time next week, telling you more about yourself and empowering you to take charge of your health. Cheers.